Welcome to Wellspring on the Air. I'm Lindsey, Steffen, a therapist at Wellspring and the host of today's show about Christians, mental health, and medications. So I am so excited to talk about this today. We talk about this with clients often and just about the role of medication in the mental health realm and how that applies to us as believers and even for unbelievers as well. So I have Nicole, Velez, Alfonso with me here today. Hi, Nicole.
Hello, everyone. Thank you, Lindsey, for joining me with this topic. It's just so important, especially now, there's so many people suffering during this pandemic. So I'm just happy to be here to talk about this.
Yes, absolutely. And I think it's something a lot of people have questions about and they're not even sure biblically like what's true or what's accurate. So we want to share from our perspective as mental health practitioners who are Christian. We want to share
Yes.
kind of what the research says, what we see in the Bible and how that all fits together. So we're going to dive in. We'll just start off like, why is this such a difficult topic in the Christian community? Why are we hesitant to take medications for mental illness?
I think it all stems from a statement that we all hear a lot, which is Jesus is enough for everything. Okay. And so all of our needs, Jesus can, fulfill all of our needs, meaning he fulfills our heart's needs, our mind's needs, our physical needs. And the issue with this is that it comes across as if our emotional and mental pains are spiritual problems. And they're not, they're separate. And so we think that our spiritual disciplines should make all those things go away. And that's just not, that's just not it,
Yeah, I have clients all the time who say they want to work on their spiritual life. And then we realize they're deeply depressed. They have no energy for any relationship. So I say, why do you think you would have energy for your relationship with God? You have zero to give right now. You're in deficit, but they feel very like a spiritual failure. And I try to assure them, once you are emotionally feeling better, your relationship with God is still there. It's still solid, but you just don't feel any of the feeling positive emotional stuff for anything right now.
Yes. It somewhat blocks in a way that relationship. It
Right.
doesn't let you have it at times
Yeah.
when you're just so not well on the emotional level.
100%. Yeah. And I think
Yeah.
there's a lot of like with this, people feel like they're lacking faith. So they think, oh, like it's all spiritual. It's all, I'm not trying hard enough, or maybe God is like kind of being far from me right now. But you're right. Really, the root is often just depression. I say, do you want to spend time with your husband right now or your best friend? No, no. You usually did, right? So with God, we just don't have the energy to interact almost in relationships.
Yes. And so I think that you bring up regarding lack of faith, that's another statement that we often hear. Well, did you pray? Have you been praying about this? And so it just shows that it makes you feel like, well, then I don't have enough faith for this to go away or for God to heal this in me,
Wow.
And I think, and that's also erroneous because the truth is that mental illness and different, depression and different mental illnesses, they reflect physically in our bodies, so there's a physical component to it. When you're depressed, your body is expressing it. People are experiencing things like being highly tired, moving slowly, difficult thinking, just cognition. You just can't think, you can't focus. So it does make sense that the way you fight against depression is also through physical strategies, right? Involving your body, and the brain also is a physical part of us.
Right. That's such a good point. I think we forget, like, if my kidneys were failing, I would get dialysis and no one would question my faith. But if my brain, an organ, like any other organ, is sick or not functioning, I need to get treatment for it. There's even, if you look at brain scans of a traumatized brain and a healthy brain, or a depressed brain and a healthy brain, they actually look different because medically they are different. They're operating
Yes.
differently.
That's huge. And I think that's something we really miss. We feel like the mind isn't a physical part of us, and it is. The brain is an organ. It's actually the most complex organ, obviously, but it is. And so we do have to take care of it as we would the pancreas, by giving the pancreas insulin because it is lacking, right? And so I think that's huge. And sometimes because we call mental illness rather than a brain disorder, right? And I think there's actually Dr. Amen, who's one, a really great psychiatrist, and he does scans of the brain. And he really says we need to be talking about mental illness more as of a brain condition. So, because that's what it is.
And that's less shaming, right?
Absolutely.
Because we act like we wouldn't expect someone to heal their own liver. So why do we expect them just to make a decision to heal their brain? Just feel better, just stop feeling that way, or just trust God. It's like, we would never say that about any other part of the physical body.
That's right. We wouldn't say that about somebody struggling with cancer in a certain organ, right? Just pray about it. You don't have to see the doctors. No, absolutely not. We need to have a wholesome, cohesive team effort in, working through whatever's happening to us. We need doctors. We need all kinds of people in our lives and different specialties to help us. And that leads us to personal failure, which is another huge kind of something that really prevents us from getting help, is feeling like we're a failure. We did everything we could, right? We prayed, we worshiped, we did devotionals every day, and nothing's happening. And so now we feel like we're a mess, and and that's where shame comes in, right?
Yeah.
We know that shame is only from the enemy. So that just prevents people from getting the help they need.
Yep. And with that shame piece, we touched on it, but yeah, when someone has a heart problem or diabetes or breaks a leg even, we don't feel shame normally. That's not the emotional. We feel maybe upset or irritated, but we never feel like, oh, I did something wrong or what's wrong with me. So you're right. It's just almost, it's not logical when we really break it down. Like, why do we get a shame response? But I think it's mental health stigma, often, unfortunately, stigma in the church, just people not having the education. So that's why we're huge on that at Wellspring.
Yes.
As believers, we love, Nicole and I have spoken at a few churches just sharing, mental health in the gospel, mental health in the Bible, because God is the great psychologist. He made our brain, he made our mind. And so he knows, that just like any other part of the body, there's things that doctors through research and as we grow in the medical field, there's things we can actually do to heal it.
Yes. And I think that's huge because God has placed many different people in our lives. When we have a financial issue, we see a financial planner. When we have an issue with a physical issue, we go see a doctor that specializes in that specific thing, right? And so same thing with our brain, right?
Yep.
And I have this quote from Ed Stetzer, who is someone that is open about mental health. He's one of the great pastors that supported us in our Shattering the Stigma event. And he talks about mental illness and how God, kind of our belief system in God. And he says, part of our belief system is that God changes everything. Sometimes we find ourselves asking, why hasn't God fixed this? Some will respond to our questioning by saying it's all because of sin, or a lack of faith, or a lack of repentance. Yes, there are consequences for sin, but just because someone is struggling with anxiety or depression or another form of mental illness does not mean it is a result of something they've done or not done.
Wow. That's powerful.
And that's huge. Yes.
This is from a pastor, right? This isn't just because sometimes people might think, oh, we're biased, but of course, because we read the research, we know what's accurate even medically. But yeah, even I think pastors are doing a great job now trying to be informed so they can get, point their congregation to the right people to give them help. Just like they say, oh, you have cancer, you go to your oncologist. Oh, you're having a brain disorder, you go to your psychologist or counselor.
And with that said, I think that piece of nothing that you have done has brought this on, right? Sometimes, yes, it's sin. Sometimes it's, that you are still in a sinful situation, but sometimes you have done nothing. right? And so this leads to the fact that there is a genetic predisposition for people. Okay, certain mental disorders are genetically predispositioned. We talk about bipolar disorder, schizophrenia, major depression, ADHD. These are things that if they run in your family, if somebody in your family has had it, there's a possibility that you could have it.
Yeah. Or
and
even
there's
with
nothing.
addiction. We see
Absolutely.
that.
Addiction, yes. Actually, if you have addiction in your family, your chances of you becoming addicted go up 30%.
Wow.
Okay.
Significant. Yeah.
Significant. It's kind of like it's in your blood. You got to be careful, right? And ADHD, same idea. And I'll go ahead and get personal here. My husband has ADHD. My son has ADHD. And it makes sense. We actually didn't find out about my husband until my son, but that's another podcast. You know how that works. It actually happens a lot but and with that said, when we were considering medication for our son, it was a hard topic even for us saying, okay, is this going to be something that's going to be good for him? How are we going to know? What are the side effects? That's normal. I think it's normal to have those questions. Right. But I'll say this, we made the decision. We had to switch him from one medication that wasn't working well to a second. That second one was amazing. My son is doing so well, so responsible in school, highly independent, organized, getting straight A's. I mean, it's for me, it's mind blowing. I'm like, what happened? Who is this? But I will say that medication has been so helpful for him to succeed, for his self-esteem, right? And these are, and again, as personally, we were in a situation where we had to consider this, and we looked at it, we researched, we talked to different people in our lives that we know would give us good counsel, and we made the decision.
I love it. And I think you're a perfect example, Nicole, because your family has a Hispanic background. So you have some stigma culturally. Then you're in the church. There's some church stigma, maybe like you had a lot against you, but you went forward despite those things because of your knowledge. And look at your son now. I know Christian and he's thriving. He even he did a podcast with us. Some of you might have heard him before talking about his success with, managing his ADHD, including medication as a part of that treatment plan. So I think, there's something too that trauma, if we have trauma in our background, that environmental piece can predispose us then to other disorders. It can be purely genetic, like Nicole was saying. So it is actually a sin issue, but it's not that we have sinned. So we're in a broken world, right? The world is broken. It is because of sin entering. There are things that we're born with, even disabilities or whatever, a heart issue from birth. And so we notice that, and our brain is affected by that broken world syndrome, we can say. And so but it wasn't that maybe I sinned. Even there's that, I'm going to butcher it, but the story in the Bible with the man, and they said, who sinned? Did his sin? And Jesus said, no, and he healed.
Nobody sinned. It's to bring me glory. And I remembered that too, when I was preparing for this. I also remember that story. And I think that, if we consider that mental illness is purely spiritual, we really hurt those who are struggling because we're pointing them to the wrong solution.
Wow. Yeah. You're not giving them the full kind of like A to Z treatment that they need. You're giving them A to M. And so there's something lacking. Yeah.
And again, we're not saying that spirituality is not important. It's actually very important. We don't get to heal unless God allows that in our lives and is in the middle of that. But we have to consider all the other options that we have and what God has brought to us here in this world to use and to, help us.
Yep, you're right on. Well, listen, we got to take a short break. We're just flying through this. There's so much good info to share, and Nicole has prepared so well. But I'm Lindsey Steffen with Wellspring on the Air. We're going to take a short break. Welcome back to Wellspring on the Air. This is Lindsey Steffen. If you're just joining our show, our topic today is Christians, mental health, and medication. And I'm here with Nicole Velez Alfonso, one of our fellow therapists at Wellspring. So far we've talked about so many good things. Just, is taking medication a lack of faith? Is it a personal failure? the answer to those questions is no, but definitely go back and listen. If you missed the first half of the show, you can go to Wellspring on the Air on your favorite podcast channel, or you can go to our blog page at wellspringmiami.org and just search for the topic, Christians, mental health, and medication. So let's keep rolling, Nicole. We have a lot more to share with the audience today. So
yes, the next point that we have, Lindsey, is about this fear that you would become dependent or addicted to medication, right? Medication that is needed for you to function mentally well and just with your mental health. And I think that I understand where that comes from, because, do I have to be on this medicine all my life, right? And the fear of not being able to get off of it. But really, the truth is that if you're in need of medication because you need to come back to baseline, right? You need to come back to a functioning level, then that's not dependence. That's actually a need. And so you just are giving whatever the brain needs to get to that baseline, right?
Yes. You're not introducing a substance like also that is addictive, like an SSRI, an antidepressant or anti-anxiety. They are not addictive. You're not going to withdraw if you stop. You do have to do it safely, but
yes,
it's not like cocaine or something where your body will physically crave it after. So it's kind of, I told Nicole before the show, I mean, I take melatonin at night sometimes. Melatonin is something your brain is naturally supposed to make to help you start to get sleepy. Sometimes my brain doesn't make enough due to whatever reason, anxiety. And so I take it, but I'm not introducing something my body doesn't know. Just like these drugs, they're often introducing serotonin, dopamine, norepinephrine, all these neurotransmitters and brain chemicals that are there, but for whatever reason, trauma, genetic predisposition, they're not, it's like the juice is run out. There's not enough gasoline in the tank. So we're just adding what's already supposed to be there.
Yeah, it's actually a completely different category of medication. When you think of medications that do create addiction, and again, we're not doctors, but there's certain medications that you become somewhat, what's that word I'm looking for?
Maybe dependent or
no, but when you are taking and you need more, you need more and you need more. You know what I mean? That word.
Your tolerance.
Yes, kind of. Tolerance. That's the word. Your tolerance keeps going up and up, and you need to take more and more and more. That's not the case with these types of medications. You get to a dose, right? You're obviously you're exploring what the right dose is at the beginning, but then you get to your dose and you're at your good dose, right? These other medications, you just want to keep taking them and taking them and taking them, and you build tolerance and tolerance and tolerance, and now you're psychologically and physically addicted to them. It's different.
Right. We're not talking so much. I mean, and some of our clients do need to take maybe a benzo or Xanax, things that are more addictive. But if I have a client with addiction history, absolutely, that's not on the table. And, we communicate with the psychiatrist and make sure we're not setting anyone up for addiction. We're super careful about that because that's a reality. But yeah, we're talking more like the general mental health, like psychotropic meds that are not addictive. And people usually, a good psychiatrist is very careful with the addictive ones and only uses them for specific reasons, and they monitor it closely. So
yes, and that's really, thank you for bringing that up, because that's huge. You got to remember when you're on medication, there is a consistent follow-up on this, right? There's, the doctor is making sure that you're doing well, that your side effects, that you don't have any, or that they're minimal. If the medication is not working, there's a change. So, there's a team of people. Obviously, if you're, seeing a therapist and a psychiatrist, even better. A lot of times we really encourage and want to have that communication with the psychiatrist so that we know what's happening and, we're working together. So, there's really good follow-up to this, from all the doctors that are working with the client.
Yeah. And I think too, I'm meeting actually with a client and the psychiatrist, the three of us this week on Zoom. So it's very much a team approach. And it's not just, you go to someone and they put you on a med and goodbye, and some psychiatrists can be that way, but you have to make sure, just like people who come to Wellspring, they trust us, they get excellent care. We refer and work with psychiatrists who do the same.
Yes. And I do think that there should be high expectations of psychiatrists. here. And if you find yourself with a psychiatrist that you do not feel good with, then it's important that you do get someone that you do think is really looking out for your best interests and will take the time to listen to you and all that. So
100%. Yeah, I've had clients
yes,
who I've advised to switch because I can tell they're not getting good care or they feel
yes,
uncomfortable. So, well, let's keep
yes,
going. We just got a
yes,
little
yes, yes.
time. So, I want to hear, I know you prepared some stuff you wanted to share on what the Bible says.
Yes. So honestly, obviously the Bible doesn't specifically talk about medication for mental illness. Okay. That's not specifically said in the Bible, but there are things that are talked about in the Bible. Okay. And it's important for when you're making these decisions. The first thing it says, you don't decide alone. You do get counsel, right? The Bible is clear about that. It's important to seek godly counsel. And so you have us at Wellspring that are Christian counselors. We often try to refer, right? And we don't always get to because there's not that many, but to also Christian psychiatrists. And so there is that need for us to have that just godly counsel. And not only that, but if you're in a small group, if you have good friends, discussing, what they see in you, right? Maybe, sometimes our friends can tell us, hey, I'm worried about you. You don't seem right. You don't seem well. And that's important counsel that we should listen to our friends when they say, I think you maybe need to talk to someone or something. I feel like you're really, just low energy, low, maybe even so sad too much, that kind of thing. So,
Absolutely. Yeah.
yeah.
I've had a friend do that for me before. She's like, you just don't seem like yourself. And I stopped and thought about it. I'm like, yeah, I need to check back in with my counselor, things are off or I'm a little lower in general. So it's good to have that.
And it could mean so many different things, but just the fact that you get someone to point that out to you. Sometimes we're very blindsided to that part of us,
Yeah, absolutely. Especially if you're in the helping field. Let me give a plug.
Oh, yes.
We're always,
yes.
if we took an assessment, we're going to underreport symptoms. People who are in the medical field too, doctors, nurses, nurse practitioners, when they come to me, I already know they're going to underreport because you're a caregiver. You're used to attuning to everyone else. So it's sometimes hard to focus on yourself.
To look at ourselves and say, uh-oh, you're not well. You're not okay. What do you need to do to help yourself?
Yeah.
Yes.
So tell us a little bit about medications just not being sinful. I think people think, it's sinful to go on medication, but it's not. So tell us why it's not.
No, and the truth is that the Lord has really graciously allowed all these different professions in the healing arts and medicines, right? And he uses all these to heal us, to help us heal. So they're not sinful. And there's actually several times in the Bible when back in those days, we talk about the healing agents of those times were, oils and what else? There was, fermented wine and different things that we don't use obviously today. But they were also considered medication back then, right? To heal.
Yep. It's what their doctors and physicians, of course, not with our medical knowledge, but what they knew then. They knew, okay, this will help treat this, or this will help the skin condition or whatever.
Yes. And also, so with, turning it to our world now, and we talk about medications for the heart to work correctly, medications for diabetes, medications for the liver, all kinds of medications. These are really helpful to us. And so we consider them definitely not sinful. They're helpful,
And I think as counselors, we have the view of therapy and medication perhaps, but we start with therapy. Research shows that antidepressants and therapy have equally advantageous outcomes. So if someone could do therapy and pull out of their depression without medication, that's wonderful. I'm all for that. But if someone is so low that they can't even do the therapeutic work, they can't get to the appointment, they can't focus when they're there, then we know, okay, we need some help. Or if someone's actively suicidal, that's
Mm,
such a severe depression that they're in danger. And so we're going to need some medication most likely. I just say, why don't you get an evaluation? I'm not saying get on
yes.
medicine because I'm not the doctor, but I am recommending you have an evaluation and see what someone who is an expert in medication, a psychiatrist, see what they evaluate, and then we'll work together.
Exactly. That is so huge, Lindsay. I think because people need to know that we believe that people can heal without medication, but some people really need it. Okay. So we again, like we said, we start off working through different modalities of therapy to help them out, right? I have a certain somewhat rule, and I say I don't consider medication after several months of having seen the client, unless I see that they can't do it. They can't do the work. They can't follow through, right? They can't follow through with the certain homeworks or doing certain exercises. At that point, whatever we do is not going to work, right? Is not working.
Yeah.
So yeah, we do need to consider medication at that point. But it's really important that you understand this is not our first resort as therapists. We are going to do the work we need to do before we get to saying, you know what? I think we need to, have an evaluation done for this.
Yeah. I always tell clients, I say, listen, you've worked hard and you actually should feel better. You're not getting the payoff that your work should produce. And that's when I know then I have a gut feeling it's a medication issue. Because my client,
Mm-hmm.
maybe they've been compliant, they do everything I say, but they're still very depressed. So we've
Mm-hmm.
done the evidence-based treatment for depression. We've done our CBT, our cognitive work, and they still aren't okay. And so I'm like, okay, this is an issue with your brain and it's not in your control. So let me take the pressure off you of working hard and feeling like you're failing. You're still not feeling
Yes.
good. So, and maybe talk to us a little bit. We got to wrap up in like a minute, but tell us about people being made in the image of God and, how that fits in here.
We are made as a holistic being, right? We are created as a whole person. So we don't separate our parts. We all work together. So when something's going on with us physically, it affects us mentally. When something's going on with us mentally, it affects us physically. So we have to understand that we look at our whole being, right? We look at physical health, nutrition, mental health, support system. I mean, we do not exist in a vacuum, and we need to understand that we have to look at ourselves as an entire person with all these different parts that need to kind of come together.
Right. I love that. And it kind of just leads me to think like mental illness doesn't mean someone is a bad Christian, right? So
Right.
God's word, it teaches us that sin is a source of illness and death. So sin in the world again, like we addressed earlier in the show. So sometimes we're not addressing a sin problem, we're addressing a physiological or psychological problem. And so we start with a spiritual response to
Mhm.
issues. We pray, we look for wisdom, guidance, we make sure there's not some unforgiven sin hindering, but really people can get stuck there. And it makes me feel for them because they're just like, there
Yes.
must be something I'm doing wrong. And it's just not the case,
Yes.
it's
Hmm.
just, again, we would never shame someone for going and getting chemotherapy. We would never question their faith or their prayer life. So I just really encourage you to start seeing the brain and looking at this as a medical issue. So anxiety,
Yes.
depression, these are actually medical diagnoses. These are not just something we say to make ourselves feel better about our mood or having an attitude. That's not it at
Hmm.
all. So it's not wrong to seek healing, right, Nicole?
Exactly. It's not wrong. It's actually the loving thing to do. It's the loving thing to do to take care of that part of yourself.
Yeah.
Yes.
Let's wrap up. I know you have some good ending points. So just
Really quickly, medicines and doctors are blessings from God, right? So we see medication that heals, physically, and it also is a way of bringing us all back to baseline. And what happens is that we are meant to do great things for God here. We have gifts to give, we have gifts to share. And if you do not get that help, you're not able to do that. You're just not able to. So, and then, of course, medicine is one of the ways that God addresses our pain. This is one of the
right.
ways that He uses. He uses this.
Just
It's
like
a
he'll use your physical health, exercising, your nutrition choices,
yes.
your social support, medication's just one more thing in that combo at times that you need to heal.
Exactly. And it is a natural response to pain. We do need medicines for pain. Like it's actually natural in us to need something like that, and not a lack of faith. It's not a lack of faith, right?
It's not. And maybe we'll end with that point that your need for
Yes.
therapy, your need for medication is not a lack of faith. So internalize that, take solace in
Mm,
that and be encouraged that you're not doing something wrong most likely, but your body and mind, they need some attention, and there are people who are there to give you that assistance. So
yes.
yeah. Nicole, thank you for coming today. We should have made this 2 shows because it's so much good stuff. So maybe you'll see another show soon and we'll revisit this important topic. So again, go to wellspringmiami.org to go to the blog page and find our other podcasts. If you would like to send us an email, questions, comments, you can write to ontheair@wellspringmiami.org. So it's time to wrap up. This is Lindsey Steffen with Wellspring on the Air, because hearts and minds matter.